So I'll comment on the lung disease specifically, okay? It is going to be very difficult. So we've known for a long time that people who have all sorts of acute lung injury, okay, can have persistent damage to their lungs. And who gets that persistent damage and why is not entirely clear, okay? So for instance, if you look at SARS and MERS when they were occurring, fortunately we didn't have those around here, they estimated that about 50% of those people had long-term damage to their lungs. You know, when we look at people with what's called acute respiratory distress syndrome from other causes, a percentage of those people will have long-term damage to their lungs. So it wouldn't be unexpected that we might have long-term damage from COVID-19. And, you know, whether that's going to depend on the severity of the lung disease when they're acutely ill is going to be hard to know. So far, it's been variable. I've seen a few patients who appear to recover but still feel fatigued and short of breath. I see other people who have persistent scar-like changes throughout both areas of their lungs. It's been all over the board at this point. I think we're, as you said, we're going to have to see what happens down the road. I think the trauma surgeon in Texas was probably commenting on the more acute processes, which can be quite dramatic. Yeah. Mm-hmm. Yeah, they may have, you know, you may struggle to find any areas of normal lung on some of their CAT scans.
That is a bit alarming.
Yeah. So the things we're going to be concerned with is development of what we call fibrosis or permanent scarring in the lungs. And that may lead to smaller lung volumes. It may lead to a problem where you have inability to get things like oxygen from the lungs into the bloodstream. And that may lead to people feeling substantially short of breath with activities and even sometimes at rest. And some of them may require even long-term oxygen.